Hi, this is Dr. Clay Brooks with Real Medicine. And today we want to talk about the Philadelphia Phillies, the first place Philadelphia Phillies, and we want to talk about Zack Wheeler's upper extremity blood clot issue. Will this derail his career? And will this derail the Phillies' hopes for upcoming playoff berth? Let's get into it. So the Philadelphia Phillies are currently in first place in the NL East at the time of this recording, with roughly 40 games to go in the season. They may have suffered a setback because one of the starting pitchers, Zack Wheeler, has been diagnosed with an upper extremity blood clot in his right arm, which is actually his throwing arm. So we'll get into that in a minute here. Currently, the Phillies at the time of this recording about 5 games ahead of the Mets. So they're doing very well, but obviously losing a starting pitcher can be an extreme blow to your potential season. So let's talk about that. So who is Zack Wheeler? Zack Wheeler is a 6'4" right-handed starting pitcher for the Philadelphia Phillies. His current record is 10-5 with an ERA of 2.71 or 2.71. He's been placed on a 15-day injured list or the IL, diagnosed with a blood clot in his right upper extremity. So, what is a blood clot? Let's get into the medicine of this. So, what is a blood clot? And why does clotting matters? So your blood actually is supposed to clot under the right circumstances. So in proper situations, if you get a paper cut or you get a cut of some from some other source, you want the bleeding to stop, right? Because if the bleeding doesn't stop, you'll bleed out and you can't lose all of your blood. So yes, we want the blood to clot. You know, another time when we'd like the blood to clot is if you're having surgery. When we're in the operating room, you know, we cut the tissues, we move things around, and there's bleeding, but we also expect that blood to clot. Again, if you lose too much of your blood or you lose all of your blood, that can be fatal. So, of course, we want blood to clot. So, there's something called the clotting cascade, also known as the coagulation cascade, which is a series of enzymatic reactions that leads to the bleeding being stopped. So, it's very important that the bleeding stops. Now, there are people with genetic abnormalities who can't clot appropriately. They have a disease or a diagnosis called hemophilia. And hemophilia is a genetic disorder. As I stated, when the blood clots, it goes through something we call a cascade, where a bunch of enzyme reactions occur with proteins in your blood that start the clotting process. Well, a person with hemophilia, they lack the proper enzymatic reactions and proteins to cause this to happen. And these people have to get transfusions or other treatments to actually replenish those things that they're missing, these clotting factors, which are proteins that are needed to help these people clot. So that's a genetic abnormality called hemophilia that you may have heard of before. So the question is, are blood clots good or bad?